I'm going to present to you the results of the survey. What I'd like to do first of all is just to thank CarerEngage Ireland and the Institute of Social Science for the 21st Century in UCC for giving me the opportunity to undertake this study. I particularly like to thank Liam O'Sullivan and Zoe Hughes and Carol Kelleher in UCC. The study was funded by the Irish Research Council, and I'm also very grateful to all the people who responded to the survey, and especially those as well who helped to disseminate the survey to get the message out there. Just to say a little bit about the National Carer Strategy before I begin. As Zoe said, it was published in 2012. And the purpose of the policy was really to set out government policy for those who provide care in an unpaid capacity. There's 4 goals in the strategy, and the strategy is really structured around those 4 goals. It also contains a roadmap for implementation, and in that roadmap there's 42 priority actions, and they're really the focus of this the survey and the presentation today. As Zoe mentioned, not all of those actions have been implemented. The strategy was implemented on a cost-neutral basis, which means that there was no dedicated funding attached to it, so that might explain some of the lack of implementation of some of those findings. But it's now over 10 years on since the strategy was published. And I suppose the focus of this research, really, there was 2 reasons for it. First of all, as Zoe mentioned, when the government was formed last year, there was a commitment in the programme for government to review and to update the National Carer Strategy. And then the Department of Health was given responsibility for leading and reviewing the update. As Zoe also mentioned, there was a CarerEngage workshop as part of the project that CarerEngage Ireland and ISSC 21 are undertaking back in October last year. And one of the issues of key importance that was identified in that workshop was the update of the National Carer Strategy. So it seemed very timely, a very opportune time to take another look at the actions within the National Carer Strategy and to see how relevant they are today in 2021, 10 years on since they were first, issued. So that's really the purpose of the strategy, is to assess the extent to which those 42 actions in the National Carer Strategy continue to be relevant today and in the years ahead. And this was to be assessed from the perspective of family carers and other stakeholders. So they included policymakers, service providers, researchers. So that was the overall aim of the survey. Just to take you through the methodology of family carers and other stakeholders, they had to be aged 18 years and older and also resident in Ireland. It was an online survey, and the survey was anonymous. The questionnaire was developed in collaboration with CarerEngage Ireland and the Institute for Social Science for the 21st Century. There was 3 parts to the questionnaire. We thought it would be useful to ask some questions just to get a sense of people's awareness, knowledge and use of the National Carer Strategy. And the bulk of the questionnaire was really around trying to ascertain the relevance of the 42 actions. And I'll tell you a little bit more about how we went about doing that in a few minutes. And then we had a closing question which allowed the respondents to identify the 3 areas that they would like prioritised and included in the next iteration of the National Carer Strategy. The survey was administered in January and February, and we had a total of 734 questionnaires returned. As you can see, the vast majority of those questionnaires were returned by family carers, but we did have responses, 37, I think the number is in all, from policymakers, researchers, and service providers. This is just a slide showing you the response to our question on awareness of the National Carer Strategy. And as you can see, there was a huge difference between family carers and the other stakeholders in terms of how much, whether or not they had heard of the National Carer Strategy. And about 2/3 of family carers had never even heard that this policy was in existence, which I think is quite surprising since it's a key policy document, that affects or rolls out the policy or the practice for family carers. So it was quite low, but quite high in the other stakeholder groups. We also asked those people who had heard of the National Carer Strategy how much they knew about the National Carer Strategy. And as you can see, that the knowledge of the National Carer Strategy is relatively low. So half of those respondents said that they had no or little knowledge of the National Carer Strategy. There was another third who had a moderate level, and just above 10% who had a high level of knowledge of the National Carer Strategy. And then when we looked at family carers compared to other stakeholder groups, family carers had a much lower level of knowledge of the National Carer Strategy than other groups, which I think you might expect. We also asked the respondents whether they felt that the strategy was personally and or professionally relevant to them. And almost 80% indicated that it was. Among the others who indicated that it wasn't, a lot of them answered don't know. So people weren't sure whether it was relevant or not. And finally, we asked a question about whether or not they had used the National Carer Strategy, to try and inform or influence any kind of reform of service provision. And very few people had actually used the strategy in this way. So just to come to the questions on the relevance of the 42 actions, we asked, it's important to know that the actions in the 42 in the strategy, we took those and we replicated them exactly as they were worded within the National Carer Strategy. And then we asked respondents to rate each one of these 42 actions. And they had 4 options to choose from. They could say that the action should be retained without change, that the action should be retained, but that it needed to be updated or expressed differently, that the action should be removed, and then there was also an option for them to say don't know. For each of the 42 actions, we also gave them an option to add a comment if they so wished. Just to say that not everybody went on to answer all of the questions on the relevance of the 42 actions. You'll be pleased to know that I'm not going to go through every one of the 42 actions and give you, an outline of what the responses were, but what I will do after I tell you about the priority areas that I've chosen would be to tell you about the kind of issues and points that the respondents were making in their comments, both in relation to the individual actions, but also in relation to the priority areas, just to give you a sense of the kind of issues that they were raising, and that will be important for the future iteration of the National Carer Strategy. But just to say, overall, in relation to the actions, for most actions, that's 40 of the 42 actions, over 90% of respondents wanted the actions retained. For the other 2 actions where that was lower than 90%, it was lower because people really didn't know. And these might have been actions where they might have been difficult to understand what they actually meant. They might have been referring to a particular report or issue that people might not have known about. But with respect to each of the actions, the percentage who wanted the actions updated or expressed differently was higher than the percentage who wanted the action retained without change. So you can have a look at the details for each of the individual actions. They're in the actual report when that's released, and you'll be able to see, each of the actions, what the actual response was, and also the comments that people made in relation to those actions. In terms of the priority areas, respondents were given an opportunity to identify 3 areas that they would like to see prioritised in the next National Dementia Strategy. So they could put in 3 responses. These were open-ended responses, so they didn't have to tick boxes or anything like that. When the responses came in, they were categorised and then they were counted. And they were rank ordered according to the highest priorities that the family carers and other stakeholders identified. And we looked at both the family carers and other stakeholders separately to see if there was a difference in the areas identified. Family carers and other stakeholders identified a wide range of areas that they would like to be prioritised. But what's on the presentation there is the areas that they were the top 3 priorities for each of these groups. You can see that the 3 areas are broadly the same for family carers and other stakeholders, but the rank order is slightly different. So for family carers, income supports was the highest ranked area that they would like to see included in the National Carer Strategy. Second came supports and services. This was much broader than the kind of community-based supports that the other stakeholders talked about. Sometimes people just said support, services, more support, better supports, but very strongly emphasized within that was home-based supports. And then the third priority for both family carers and other stakeholders was respite. I'm just going to go through some of the kind of key points that were raised in the comments by the respondents in relation to each of the goals. So the first goal in the strategy is to recognise the value and contribution of carers and promote their inclusion in decisions relating to the persons that they're caring for. There's 14 actions that are linked to this goal. So one of the big issues, I suppose, that was highlighted by respondents was in relation to recognition. And right throughout the comments from family carers and from other stakeholders was that many family carers still feel invisible or forgotten, even 10 years on after the National Carer Strategy was released in 2012. And even though recognition is quite a strong element of that strategy, they felt that the word recognition was unclear, describing it as vague or nebulous. And they also went on to kind of speak about what recognition means to them. And it was more than just words or, celebrating carers or giving them awards. They wanted to see concrete responses to recognition of family carers, such as recompensing carers for the work that they do and the contribution that they make to society. They wanted carers recognised by the provision of adequate supports to enable them to continue caring for the people that they provide care to. And they wanted it recognised by their involvement in decision making. In terms of inclusion and decision making, one of the actions in the National Carer Strategy is to consider the needs of family carers in developing policy. But it was very clear from the responses that family carers and other stakeholders wanted families to be much more involved in actually developing policy, not just to be considered. And they wanted the voices of all carers to be heard. And they felt that with kind of online means of including people now, that it should be much easier to enable a broader range of voices to be heard. There's actions in the strategy that are really about identifying carers, and carers really did want professionals to reach out rather than them having to self-identify. But they also wanted a lot more to be happening in the background in terms of professionals linking in with each other within their own organisations and across organisations as well. So it wasn't just about a dialogue between the carer and the professionals, but also within the organisations within which these professionals worked. And there was a strong sense that they would like co-production in care planning and decision making when it comes to decision making in relation to the person to whom they provide care to. So that would involve the person who is being cared for as well as the family carers. And the sense that this was a two-way process and dialogue between the parties involved. They highlighted that care planning, including discharge planning from acute hospitals, takes time, and they wanted good communication from health professionals and other professionals as well. And they pointed out that it's very hard to make decisions, or you're not able to make the decisions that you would like if the adequate supports and services are not there and available and exist that allow families to have the decisions that they want. Income supports in the strategy, a lot of the actions are around improving information and advice on care and income supports and reducing waiting times. But the comments really stressed, issues around the fundamental structures of income supports for family carers. And there was a lot of questions raised about them, which I'll come back to later on. The second goal in the strategy is to support carers to manage their physical, mental, and emotional health and well-being. So with comments here, carers really wanted a broad understanding of health and well-being. So for example, some may be experiencing financial issues, so the impact that might be having on their health and well-being was an issue that they'd like, addressed. They wanted an understanding that family carers face barriers. So, for example, one of the actions is around attending GPs for an annual check, but some family carers find it hard to find time to even get to the GP, or because of the charges that are involved may not be able to afford to attend. So they wanted these kind of barriers understood. And they also wanted this to be achieved through assessment, through a carer's needs assessment, but also that this assessment is followed up with concrete action, and that there's ongoing review and monitoring, just to make sure that families' health and well-being is maintained. There's a number of actions around the carer's needs assessment, around the review of the financing of home support services, and also the development of standards for home support. And there was a lot of frustration about the slow progress in relation to these actions. There's 4 actions that are specifically related to children and young people. And I suppose the main concern that most respondents expressed was this concern about children having to bear the responsibility of caring. And they didn't feel that this was right, especially when they were the main carers, or because there was inadequate supportive services. They also wanted to see a greater role for education providers, not just that they were aware of this issue among children and young people, but also that they were able to do something about it, link them in with proper supports, and that service providers would outreach and engage with young people caring for people in their families. The third goal then is to support carers to care with confidence through the provision of adequate information, training, services and supports. And there's 9 actions linked to this goal. One of the points that the respondents raised was that there's been significant improvements in relation to online provision of information, mainly to do with the development of online supports. And I suppose this has been, grown over the past year or so. But they still felt that there was room for improvement, especially around staff training, so that they understood the needs and the information and advice needs of family carers. They'd like to see a single point of contact for family carers, and also information that they were provided with on its own is not enough, but it needs to be followed up with action. They highlighted the challenges for some carers, particularly those with literacy difficulties, with hearing impairments, who may have a cognitive impairment or may not have English as a first language. They really welcomed the actions where there was promising a greater range of caregiver training, such as blended training or online learning, and they would like this to be developed further. And they also made comments in relation to housing, assistive technology and transport. The final goal then is to empower carers to participate as fully as possible in economic and social life, and take action to this goal. Respite, there's a number of actions around respite under this goal. One of them is in relation to the Carer Support Grant, which back in 2012 was known as the Respite Carer Grant. And a lot of the respondents highlighted this change, and they welcomed the change, but they felt that there was still a need for greater awareness and also access to the Carer Support Grant. They greatly welcomed the development of person-centered, flexible approaches to respite. But the experience of the respondents was very varied. Some had very good experience of, different types of innovative models of support. Others had no access to respite whatsoever. So a key message was that there's many gaps still existing, and this was exacerbated by the pandemic, where people had no access to care and to overnight respite. But there seems to be a strong demand for in-home respite as well, and peer support as well among family carers. There's a number of actions around the participation in the labour market, and quite a number of respondents pointed out that they would like to be involved working in the labour market, but it wasn't an option, mainly because they were caring full-time and they just couldn't take time out to be part of the labour market, but also because some of the predictability of caring, and they didn't feel that employers would be flexible enough to allow them to combine work and care in the way that they needed to. And there was challenges facing carers who are participating in the labour market. So, for example, Some carers are available or receiving carers allowance is a threshold on the amount of hours that they can work, but this is very well understood by employers, and especially when they may be in jobs where it was hard to negotiate those hours, that could be quite difficult. And they highlighted that transition points into and out of the labour market are key points, and these really need to be supported. That the Carers Leave Act, that awareness of that still remains very low. And there was also a sense that it's not just about balancing work and social life for people who are in the labour market, but people who are unpaid carers also need to be able to balance their unpaid work with trying to have some kind of social life for themselves as well. So they didn't want to be forgotten about. They felt that they were still workers, but in an unpaid capacity. Some of the take-home messages then are that all of the 42 actions in the strategy continue to be relevant. One of the key messages to come across was that these actions need to be strengthened. A lot of the actions use words like promote or raise awareness, and the respondents really wanted to see these strengthened and much more kind of, I suppose, looking at bringing about change rather than just raising awareness or promoting something. There was also a sense that there was a need for a greater focus on implementation of the actions. And again, this was reflected in some of the words that were used in the actions. And there's some examples given of where those words might need to be changed in the next strategy. I suppose reflecting on the strategy, if you look back, although there's a roadmap for implementation, there's no outcomes attached to the National Carer Strategy. And although there's a lot of different organisations given responsibility for implementing individual actions, there may be a need for, maybe within the HSE, an organisation or an office that has responsibility for implementing the actions that are relevant to health, for example. It was a very clear message that family carers want to be recognised, and I mentioned some of that earlier. They want to be listened to, and they want to be involved in both developing and implementing policy. Income support was the top priority for family carers, but it was less about, I suppose, tinkering at the edges of the current system, but looking at how, there might be greater support for a greater number of family carers rather than the mean-tested carers allowance at the moment, and also more generous payments. So that really raises very, I suppose, hard and difficult questions for policymakers about income support and how to support family carers. It's not easy, whether you target it to certain family carers or you try to broaden it out. There's trade-offs in that respect. Community-based supports are critical for well-being of both the carer and the person being cared for, and there was real demand, particularly for respite and home support. An issue, it's not in the original strategy, but one of the issues that really came across, I suppose it was a cross-cutting issue, was the diverse needs and the diverse circumstances of family carers, and the need to pay attention to those differences between family carers and trying to respond and tailor to the different needs. And there was also a desire for joined up integrated support and services. And I suppose not just at a service level, but also at a policy level as well, in terms of, this strategy cutting across not just the Department of Health, but also the Department of Employment and Social Protection, Transport and Housing. And there needs to be joined up thinking around that as well. And finally, it was very clear that online supports, the pandemic, if anything, has shown the opportunities that this provides, and the respondents doesn't want to see this forgotten about once the pandemic is over. And these online supports are very valuable for carers who can't take time out of care, can't leave the home to attend face-to-face programs. And this is something that would need to be developed in the future iterations of the strategy. So they're the kind of key findings and messages from the survey, and hoping that these will be useful for the Department of Health in their review and update of the national strategy, but also maybe useful for your discussion today in terms of the future directions for that strategy. So thank you very much.